Well, hello. Hi, Sheila. Thanks so much for joining us today. It's really good to speak to you again.
Hi, nice to talk to you as well. Thank you.
I wanted to ask you about your experience with helping the COVID response in Massachusetts, because that's certainly been one of the few success stories, I would say, in the US response to this pandemic. What works? What has gone right?
I think this was a strong collaboration that Governor Baker put together that brought together Department of Public Health, local boards of health, community connector, community health centers, and then Partners in Health as an NGO partner. And, rather than building a parallel track, the whole program was intended to supplement the existing public health system that already existed in Massachusetts.
Mhm.
So the local boards of health have continued to be the leaders in this, and then we've built an army behind them to do the contact tracing. And I also think a big emphasis has been on providing social support when needed, so that when we're finding contacts and we're contacting them and to say, you need to isolate, you've been in close contact with somebody who's tested positive, that we're connecting them to local resources, food banks, if they need to isolate safely. So I think it's a comprehensive program, not just looking at one aspect.
And there's been a lot of talk, given the massive surge in cases in other parts of the US, that there's worry, I think, that parts of the country are now beyond the point where testing and tracing might work, where the virus is spreading so quickly that it's going to overwhelm our capacity to do things like contact tracing. Do you think that's right, or do you think those basic public health measures will still work in the most hard-hit areas?
I don't think we have a choice. I think we have to do it. That's, been a long tried and true epidemiological tool for many, many years. And so although when the cases are super high, that's not the time to be building a contact tracing program, we know that essentially a certain percentage of people will go to the hospital, certainly, and testing will happen there. But that's not when you're stopping transmission. You're stopping transmission before it gets to the hospital. So although it may seem that it's an impossible task, there has to be a commitment to contact tracing and a whole comprehensive program, or we're just waiting for people to show up to the hospital and die. I mean, I think the options are you just watch and let an avalanche happen, or you do the best you can to stop it wherever you can.
And we've talked about this before, but I think it's fair to say that this sort of reflects America's attitude to health in general, that it's too focused on that latter bit, or on treating sick people who arrive at hospitals rather than stopping them from getting sick in the first place. Do you agree with that? Can you say more about that public health imperative?
Yeah, definitely. If we look at the public health in the United States over the past few decades, it's been, systematically defunded. And what's happened then is our whole entire health system is based on the hospital, which is the most expensive place to provide care, the most expensive healthcare providers. And you need that. You need expert ICU care. You need critical care physicians and nurses. But what you want to be able to do is push the care also into the community. The community is an early warning system for any type of infections and pandemic. People are more apt to seek care closer to their home. If you're pushing care into the most vulnerable communities, people are much more apt to do health-seeking behaviors. So we need to restructure, I think, our entire healthcare system. And rather than investing so small amount in public health, I think it's like less than 3% of $3.4 trillion or something that's spent on healthcare is spent on public health. And then a pandemic like this has shown us that that's the problem.
Right, and your organization works with a lot of countries around the world. I know you have regular phone calls with partners in all kinds of different nations where this is very different, where the attitudes to healthcare and the way healthcare is grounded and threaded through the community works very differently. How are you thinking about that? How are your partners in other countries looking at what is happening in the US right now?
I think they're incredulous just at the amount of money that's spent in the US and the circumstances we're in now. I think, things are not perfect. We need ICUs in Sierra Leone. Like we 100% need high level healthcare. It's not utopia by any means, but there's a healthcare system in most places that we work, and we work closely with ministries of health, where we have community health workers, where we have nurses embedded in the communities. It's just a more functional health system in terms of a community and an effort that's not just based on when people get so ill that they need hospital care. And that was done because we didn't have good hospital care. So we don't want to abandon our efforts to increase our level of care there, but I think we can learn quite a bit from Rwanda, which has had a phenomenal response in really aggressive contact tracing and testing, doing really innovative testing programs. So I think it's time for the US to see where we can learn from other places that have done it better.
Right, and I think in global health, traditionally the posture has always been the US is the one that goes to other countries and provides money and expertise and
Right.
whatnot. And I think what it sounds like what you're saying is that the pandemic should teach us that we are also students, and we should be learning lessons from other countries that know how to do parts of this better. Is that right?
Yeah, definitely. And and I think we have morning meetings where all the different countries get on the line together and share with each other and advocate for PPE together, all of the ways that we as a system should be really fighting for more equitable healthcare. But also that's where the Rwanda team gave testing suggestion strategies for other states we're working in now based on our Massachusetts work. And it really is, I think, a time where we can be humble as a nation and say we're really good at some aspects of healthcare, but we're really not good at others. And COVID has really shown also that the most vulnerable in the US by far are the most hard hit, and the disparities are so evident. So we really have a responsibility to address that.
So can you play out the counterfactual for me? Like if the US had truly invested in public health instead of underfunding it over the last several decades, like what would have happened in say the spring of this year when the coronavirus started spreading? Like what would an efficient national response to that have looked like?
I think we definitely need a national response. I think the CDC is, even in the past few days, their power has been taken away, and that the reporting for COVID is not going to go to the CDC anymore. So we definitely need a national plan. But if we had a functioning public health system, there would be people already embedded in the community that could be telling people what contact tracing is, to pick up the phone, to know where the vulnerable communities are. People would seek healthcare sooner. People, if they had questions, would be able to know who to go to and not have to wait till they get sick. And then also in terms of supporting each other, we very much, I think the one thing we'd be proud of is I think people have mobilized to help their neighbor, but it's varies place to place. Whereas if there was a functioning public health system that could identify people already at risk for hunger, already at risk for homelessness, that then those people would have gotten special attention sooner, and we would have prevented the most vulnerable from being impacted.
Yeah, I feel like a lot of attention during this pandemic has been paid to biomedical countermeasures like therapeutics and vaccines, and much less so to the social safety net that underpins a lot of the preventive health that you've been talking about. Is that fair? Do you think America needs to reinvest in that safety net?
Yeah, I definitely agree. And if we look at where the most lives have been saved over the past century, as well as in terms of life expectancy, it's been in public health measures. It's vaccines, it's ways of addressing hunger, of addressing malnutrition, of infectious diseases like TB. And I think that our challenge is now that it's so much attention is played on the curative factors, which again, very important, but not the preventative factors. And until we let these two things coexist and be synergistic with each other and not look like either or, we're going to continue to have this. And we're in this definite cycle of we're neglecting systems, then we panic, and then we repeat it, and we throw money into something, and then we all lose our interest. In West Africa, before the Ebola outbreak in 2014, 2015, there just happened to have been an assessment of what would it take to build up a health system essential health system in the three countries before Ebola, and it was like 1.2 billion. And that didn't happen because the world decided it was too expensive. And then Ebola happens and 4.3 billion gets committed to facing and combating an epidemic, which should have happened definitely, but then no health system is left behind. So we're in this constant cycle. And I think in the US, we're seeing it with COVID, definitely, that our investment in only one aspect of comprehensive healthcare is causing this pandemic to cause this havoc and cause so many deaths and stopping of the economy. You know, really has been a runaway train.
It feels like we're already looped into that cycle, even though the pandemic isn't even over yet. We're already in the neglect bit when the panic bit is still ongoing. So I guess my final question to you is, do you have any optimism that we could break this cycle? Is COVID the thing that will break it, or are we destined to loop through it again?
You know, I think to work for Partners in Health, you have to be an optimist. So I'm the eternal optimist that we're very smart people. We actually have funding. We have the ability to really use this horrible tragedy to rethink and end up with a much healthier nation than we had before. But it's going to take political will, and it's going to take people saying this is enough and we need to change this, and we need to be open to a different type of comprehensive healthcare that looks different than it does now.
Mm-hmm. Well, I for one am very grateful for the optimists among us. So thank you for that perspective, and thank you for talking to us today. We really appreciate it.
Thank you. Take care.
Take care.